The monitor flatlined at 11:47 p.m., and the surgeon still hadn't listened. For 6 weeks, Nurse Mara Ellison had watched Dr. Callum Hext operate like a man who believed his medical degree made him infallible, dismissing every concern she raised, talking over her in trauma briefings, and filing a formal complaint when she dared correct his fluid order on a septic patient who would have died without the correction. F.A. Mara had said nothing to defend herself. She had signed the disciplinary form. She had absorbed every humiliation with the same stillness that made her colleagues mistake her for indifference. They didn't understand where that stillness had been forged. Nobody at Harwell Memorial Hospital in Spokane, Washington did. But tonight, a dying man was about to force the secret into the open, and the surgeon who wanted Mara gone would have no choice but to watch her save a life he couldn't. If this is your first time here, subscribe before this story is over, because the next one hits just as hard, and you will not want to miss it. Hit the like button and drop a comment telling me what city and country you're watching from. I want to see exactly how far this story travels. The shift had started badly and declined from there. Mara arrived at Harwell Memorial 40 minutes before her 7 p.m. start. Because the bus ran early on Tuesdays, and because arriving early meant she could review the incoming patient board before the charge desk got chaotic. She was 31 years old, stood 5'6" in her work shoes, and had a habit of standing slightly apart from groups in a way people sometimes read as aloofness. It wasn't. It was a habit she'd picked up in a different life, the habit of maintaining sightlines, of keeping her back to walls, of always knowing where the exits were. She poured coffee from the break room machine, looked at the board, and noted 3 trauma holds flagged from the afternoon that hadn't resolved. A construction worker with a crush injury to his right arm. A teenager with a possible closed head injury from a skateboarding fall. An elderly woman, cardiac history, brought in by ambulance after her neighbor found her unresponsive on a porch. Mara was reviewing the elderly woman's most recent vitals when Danielle Crow walked in. Danielle was the charge nurse for the evening shift, 44 years old, competent in the narrow technical sense, and possessed of a particular professional anxiety that expressed itself as authority. She needed to be the smartest person in her visible radius, and Mara's quietness, her refusal to compete, to explain herself, to perform effort, made Danielle nervous in a way that had long since curdled into hostility. Ellison. Danielle set a clipboard on the counter without looking at her. "You're not on the crush injury," Hext requested Paulson. Mara looked up. Paulson called out an hour ago. "I checked the board when I came in. Then I'll cover it myself until I find someone. I've managed crush injuries," Mara said. "I can take it." Danielle finally looked at her. It was the kind of look that communicated everything without saying anything explicit, the slight elevation of the chin, the controlled blink, the careful pause that was itself a form of dismissal. "Dr. Hext has preferences about who assists him. You know that." Mara did know that. She'd known it for 6 weeks. Ever since the first week of her rotation, when she'd flagged a misdosed anticoagulant during one of Hext's post-op reviews, and he'd responded not with acknowledgement, but with a formal note to Danielle suggesting that Mara had a boundary problem and difficulty respecting physician authority. The note had landed in her personnel file within 48 hours. She'd said nothing at the time. She'd read it, signed the acknowledgement form, and returned to work. What she hadn't done was stop noticing things. "Understood," Mara said, and carried her coffee to the nursing station. The crush injury patient, a man named Gerald Peck, 47, construction foreman, was in Bay 4, right hand wrapped, blood pressure still elevated from pain. Mara wasn't assigned to him, so she didn't approach him directly. But she watched the monitor feed at the station and kept track of his numbers with the particular kind of peripheral attention that looked to untrained observers like she was focused on paperwork. She was focused on the paperwork. She was also watching Gerald Peck's blood pressure trend. Dr. Callum Hext arrived on the floor at 7:40, 20 minutes past his own scheduled start, in the unhurried way that senior physicians developed when they'd spent enough years in institutions that accommodated their rhythms. He was 53, broad-shouldered, with silver hair, and the careful grooming of a man who still noticed how he appeared. He was not a bad surgeon. Mara had watched him work, and he was technically competent fast, economical with motion, comfortable under pressure. The problem was that competent had become, over time, indistinguishable in his mind from correctness, and there was a significant difference between the two. He moved through the nursing station without acknowledging Mara and stopped at Danielle's desk. "Where's Paulson?" "Out sick. I'm covering 4 until... I need someone who can scrub if we end up taking Peck to the OR. Who do you have?" Danielle glanced once at Mara, a glance that meant, "I know, and I'm not going to say it," and then back at Hext. "I'll pull from the float pool." "Fine." Hex picked up Peck's chart. "His pressure's still high. Pain management is ongoing. It shouldn't still be this elevated for pain alone." He flipped 2 pages. "Schedule a chest X-ray before we decide on the hand." Mara looked up from her computer screen. Gerald Peck's hand injury had been the presenting problem. A mechanical press at a site had trapped and released his right hand, and the visible damage was significant. But elevated blood pressure in a crush injury patient wasn't only about pain. Crush injuries released cellular contents into the bloodstream. There were secondary concerns: cardiac strain, renal stress, the possibility of compartment syndrome extending beyond the obvious site. There was also the possibility that the machine had done more than just catch his hand. His abdominal presentation on intake noted, "Guarding," Mara said. Hext turned slowly. The way he turned when interrupted the controlled pivot, the deliberate reorientation, was itself a kind of performance. It communicated that she had pulled his attention from something more important. "What?" The intake notes from the paramedics. He was guarding his lower left abdomen when they loaded him. "It's flagged, but not followed up." Hext looked at the chart in his hand. He did not immediately say she was wrong. He read the flag, which told Mara he'd either missed it or deprioritized it, and neither was good. "He presented with a hand injury," Hext said. "The guarding was logged as a pain response." "Possibly," Mara said. "But if the machine caught him off balance and he hit the frame on the way down." Ellison. The name, just the name, delivered with a specific weight. "I'm aware of the intake notes. I reviewed this patient before you came on shift. The implication was clear. You are looking at the same information I already have, and your interpretation of it does not supersede mine." Mara held his gaze for 2 seconds, then returned to her screen. She said nothing else, but she noted the time 7:53 p.m., and she continued watching Gerald Peck's monitor feed. The float pool sent a nurse named Tommy Riddell to assist Hext in Bay 4. Tommy was 26, pleasant, and had exactly the quality Hext preferred in his support staff. He executed instructions without interjection. Mara watched them through the bay window while she finished her documentation on the cardiac patient in Bay 2. At 8:31 p.m., Gerald Peck's blood pressure spiked. Not a pain-related drift, a spike systolic, jumping from 148 to 171 in under 4 minutes, is accompanied by a heart rate climb and a new complaint from Peck himself, who told Tommy that his stomach suddenly felt wrong. Mara was already moving before Danielle noticed the monitor. She stopped at the bay door because she hadn't been assigned and Hext was inside. And there was a version of this where she walked in and made everything worse for herself without helping Peck. She knocked on the glass panel beside the door instead of entering. Hext looked up. She pointed at the monitor readout, visible through the window, then at Peck's abdomen. Hext stared at her for a moment with an expression she'd seen before, not contempt exactly, but something adjacent to it, the look of a man who had decided that a person's persistence was itself evidence of poor judgment. He turned back to Peck without responding to her. Mara stepped inside anyway. His pressure spiked 6 points in under 5 minutes, she said. He's reporting new abdominal symptoms. I can read a monitor, Hex said without turning around. I know you can. I'm telling you what he just said. Hex looked at Tommy. Did he report abdominal symptoms? Tommy hesitated, caught between two people, which was the worst place Tommy could be. He said his stomach felt off. I was about to document it. Hex turned to face Mara fully. He crossed his arms. Ellison, I have a patient in front of me. I will manage his care according to my clinical assessment, which does not require real-time editorial input from the nursing station. This is not a conversation. Please return to your assigned bays. His original intake is something I've reviewed. Voice did not rise, which was somehow worse than if it had. If you have a formal concern, you can document it through the appropriate channels. If you continue to interrupt active patient care without assignment, I will log this as a second behavioral incident. Do you understand? The bay was quiet. Tommy was looking at the floor. Peck was watching Mara with a particular expression of a man who was in pain and frightened and couldn't tell yet whether the person being shut out of the room was right. Mara understood. She understood all of it, the dynamic, the structure, the consequence, the fact that another formal incident would likely trigger a performance review that could end her position at Harwell. She also understood that Gerald Peck's abdomen was hardening, that if she walked out of this bay without saying the next thing she was about to say, she might be making a decision she couldn't reverse. Splenic laceration, she said. He took impact to the left side. The guarding on intake, the pressure spike, the new pain that's not hand trauma. Heck's jaw tightened. Get out. She left. She walked to the nursing station, sat down, picked up her pen, and began documenting her observation. The time, the vital signs, the patient's reported symptom, and her clinical concern, all entered into the record with the date stamp showing 8:33 p.m. Not because documentation would help Peck right now, because it was what she could still do. Danielle appeared at her elbow 4 minutes later. Hext is filing the incident report tonight. I know. Mara. Danielle sat down and lowered her voice, which was the only concession she made toward privacy. You do this every time. You walk into something and make it confrontational, and I'm the one who has to manage the paperwork. You have one formal incident already. If he files tonight, that's 2. That's a review board. I documented my concern at 8:33, Mara said. It's in the system. That's not going to protect you if minus. Peck's monitor alarmed. Both of them looked up. His systolic had jumped to 184. His heart rate was 118 and climbing. The tone of the alarm, the specific cadence Harwell's monitoring system used, indicated a second parameter breach, had triggered simultaneously. Hext's voice came through the bay intercom, controlled but compressed. I need a surgical consult now, and get me an ultrasound in here. Danielle was already moving. Mara sat still for exactly 2 seconds, watching the monitor feed. Then she got up and followed. The next hour was organized chaos, which was the best version of chaos available in a hospital. The ultrasound confirmed what Mara had logged at 8:33 p.m. Free fluid in the abdomen, concentrated around the spleen. Gerald Peck had a grade 3 splenic laceration, almost certainly from secondary impact during the machine accident, sustained at the same moment as the hand injury, and masked by the more dramatic visible damage to his hand. The surgical consult arrived. Peck went to the OR at 9:18 p.m. He survived. The surgical team controlled the bleed and saved the spleen. Hext said nothing to Mara when he came off the floor. He walked past the nursing station, collected his coat from the physician lounge, and left. Danielle handed Mara a printout at 10:45 p.m. It was the incident report, filed at 9:02 p.m., before Peck had even reached the OR, before the ultrasound results had been formally returned to the record. filed while Gerald Peck was still in the bay with a ruptured spleen and a rising heart rate. Hext had taken the time to document her behavioral infraction while his patient was deteriorating. Nurse Ellison demonstrated repeated refusal to comply with physician direction and persisted in interrupting active patient care despite direct verbal instruction to cease. This constitutes a pattern of insubordination that escalates a prior incident and warrants formal review. Mara read it twice. Then she picked up a pen and signed the acknowledgement line. Danielle watched her sign it. Something moved across. Danielle's face, not sympathy exactly, but something that was uncomfortable with itself. A flicker of recognition that passed quickly. Review board meets in 10 days, Danielle said. I know the timeline, Mara said. She set the pen down, straightened the form, and went back to work. There were still 4 hours left on her shift. The cardiac patient in Bay 2 needed her 11 p.m. Vitals documented. The teenager with the head injury had been moved to observation and would need neurochecks at regular intervals. The night was not done with her. She did not mention to Danielle or to anyone that her hands had been perfectly steady while she signed. Not from calm. From a different kind of control, the kind that didn't come from nursing school, that didn't come from any hospital corridor she'd ever walked, that came from somewhere she'd left behind and carried forward simultaneously, like a wound that had healed around a piece of shrapnel and learned to work with it still inside. At 9 a.m., Harwell Memorial's emergency radio channel received a transmission that the communications coordinator initially flagged as a misdirection. The channel it came in on was federal frequency that civilian emergency dispatch didn't routinely monitor, routed to Harwell's system through a protocol established after a post-9/11 infrastructure agreement that most current hospital administrators had never had reason to use. The coordinator, a 23-year-old named Beata Schultz, who had been on the night shift for 4 months, listened to the first 30 seconds, marked it urgent, and ran the printout to the charge desk rather than waiting for the automated log. Danielle was at the desk. She read the transmission twice. Her face changed. Get Dr. Hext back in here. He signed out at minus. I know when he signed out. Get him on the phone. Danielle looked up. And get Ellison. Mara was in the supply corridor when Danielle found her. She read the transmission once. Then she read it again. And this time, her expression shifted in a way that Danielle couldn't quite catalog. Not fear, not excitement. Something more deliberate than either. Recognition, maybe. The specific recognition of someone who understands not just what words say, but what they mean in a structure she already knows. How many casualties? Mara asked. The transmission says 1 critical, possibly 2 secondary. They're requesting full trauma activation. Airlift? Rotary. ETA 14 minutes. Mara handed the transmission back to Danielle. Who else do we have on tonight? For trauma? You, Riddell, and whoever I can pull from the second floor. Pull them now, Mara said, and call the OR. Tell them to hold the room they just turned over from Peck. I'm the charge nurse, Danielle said. I'll decide what? Danielle. Mara said her name without sharpness, without the performance of authority, just with a directness that stopped the sentence. If that transmission means what I think it means, we are going to need that OR ready before the rotary lands. Call them now. There was a pause. Danielle called the OR. Mara went to change her gloves. She paused at her locker, and something happened that she would not have permitted in front of anyone. Watching her hand went briefly to the inside of her scrub top, touching something flat and metal that hung there on a worn cord. Something she'd worn so long it had ceased to feel like a separate object and had become simply part of the weight she carried. She pressed it once through the fabric. Then she closed her locker and went to Trauma Bay 1. The military helicopter did not announce itself gracefully. It came in faster than standard medical rotary approach, with the particular urgency of a crew that had already been flying on compressed margins and wasn't interested in a gentle landing. The rooftop landing crew at Harwell felt it before they heard it, the thrum of the rotors hitting the building's superstructure and reverberating down through the floors like a physical instruction to move faster. Mara was at the trauma bay entrance when the elevator doors opened. 4 people came out, 2 military medical personnel in flight suits, moving with the organized speed of people spew who had been doing this in worse conditions, and 2 others in tactical gear who were not medical staff. They were escorting the gurney, not for ceremonial reasons, for security. The patient was a man named Commander Brant Holloway. Mara didn't know that yet. She knew what she could see. Male, approximately 40, combat-fit build, now severely compromised by penetrating chest trauma sustained during what the flight medic's verbal handoff called a training accident involving mechanical failure at altitude. He was intubated in the field, both IVs running wide open, chest dressing already saturated through the primary and secondary layers. His saturation was 84%. His blood pressure, as of 2 minutes prior, was 72/40. He was dying at a pace that was not theoretical. Trauma 1, Mara said, and moved. Hext had arrived. Someone had reached him. He'd driven back in, and he was now at the trauma bay in his street clothes, under a hastily pulled-on white coat, which meant he'd been home then 20 minutes when the call came. He stepped in beside Mara as the gurney came through. "What are we dealing with?" he asked the flight medic. "Penetrating chest, left lateral. Possible pneumothorax, we couldn't confirm in flight. Fragment is still in situ, we couldn't extract safely. Blood product transfusion in field? 2 units packed red cells, 1 FFP, started 15 minutes out. Okay." Hext looked at the dressing. "Let's see it." The dressing came off. The wound was worse than the numbers suggested. Fragment entry on the left lateral chest, roughly at the 7th intercostal space, with blast pattern, bruising, radiating outward, and tissue disruption that told Mara, before anyone had put a probe near him, that the fragment had traveled inward at a non-perpendicular angle. Not straight in, diagonal, which changed the internal geography of where the damage might be. Hext looked at the wound. "Chest tube," he said, "and get ultrasound in here." Tommy was there. They'd pulled him back in, and he moved immediately. Mara positioned herself on Holloway's right side, tracking his monitor, adjusting the oxygen, noting that his saturation was now 81%, and the waveform on the pulse ox was losing its sharp peaks. His heart rhythm was sinus tachycardia, with occasional widening complexes. She looked at the wound again. At the entry angle. At the dressing pattern the flight medics had used, which was a military hemorrhage control application she recognized not from nursing school, but from a different classroom entirely, one that didn't have desks. "Hold on the chest tube," she said. Hex looked up. "His oxygen is dropping, and his rhythm is changing," Mara continued. "But the fragment's position, look at the angle. If it went in low and lateral at that trajectory, it didn't go into the lung field. It went toward the mediastinum." Hext stared at the wound. "You can't determine trajectory from an entry. The flight medic said mechanical failure at altitude. That means the fragment hit him while he was in a specific position, probably elevated, forward, leaning. That changes the angle of penetration from what it looks like standing here." She met Hext's eyes. "If I'm right and you place the chest tube in the standard position, you're draining the wrong space. And if the fragment is adjacent to a vessel, the pressure change from the tube could dislodge it." The room was quiet in the specific way that trauma bays got quiet when the momentum of action ran into the wall of an unresolved clinical question. Hext looked at the wound. He looked at the monitor. Holloway's pressure read 68/38. "Ultrasound," Hext said. Mara was already reaching for the probe. She placed it at the subxiphoid position, first standard cardiac window, and the image came up, and what she saw made her still in a way that only people who have seen that particular image before can be still about it, because stillness was the appropriate response, and panic was not useful. There was fluid around the heart, not a lot, but enough. Tamponade, she said. Hext looked at the screen. His jaw worked once. We need the OR. We don't have time for the OR. Mara set down the probe. His pressure is in the 60s. If we move him, we lose him in the elevator. You're talking about a bedside pericardiocentesis on a trauma patient with a fragment in situ mine. I'm talking about draining the tamponade so his heart can fill again. Then we stabilize him enough to get upstairs. She looked at Hex directly. If we wait for the OR, he goes into arrest before the elevator reaches the 3rd floor. The 2 military security personnel at the door had not moved, but one of them older, with the particular stillness of someone who had been in enough rooms like this to know what it looked like when the civilian medical team was losing the thread, was watching Mara, now in a way that was different from how he'd been watching Hext. He hadn't said anything. Not yet. Holloway's monitor sounded a new alarm. His heart rate was 138, and the complexes were widening. His systolic had dropped to 61. Hext looked at the monitor, looked at the wound, looked at Mara. What do you need? He said. It was not capitulation. It was not trust, not fully, not yet. It was a man running the numbers on the only options available and finding that the arithmetic kept returning the same answer. Pericardiocentesis kit, 18-gauge spinal needle, 50 cc syringe, and I need everyone to stop moving for 30 seconds so I can work. Someone moved to get the kit. Hex said nothing. Mara pulled on a fresh pair of gloves and positioned herself at Holloway's left side, below the xiphoid, and she was already calibrating the angle in her mind, not from a textbook diagram, not from a simulation lab, but from the specific physical memory of hands that had done this before in conditions that made this trauma bay look like a library. Her hands were completely steady. Commander Brant Holloway had 9 minutes left before his heart would be unable to compensate for the fluid crushing it from the outside. And the nurse that Dr. Callum Hext had formally accused of insubordination twice in the same shift that had just become the only person in the room who could stop the clock. The kit landed on the tray beside her, and Mara didn't look up to see who had brought it. She was already counting not seconds, exactly, but the intervals between Holloway's widening complexes on the monitor, the rhythm of a heart being slowly strangled by fluid it couldn't expel, a rhythm she had heard before in places where its nearest surgical facility was a 40-minute helicopter ride away. And the difference between action and hesitation was a body bag. She uncapped the needle. Someone call his pressure again, she said. Tommy was at the cuff, 63/36. Hold that arm still. She found the angle subxiphoid, 45 degrees toward the left shoulder, the same angle she'd used the first time she'd ever done this, which had been in the back of a lurching aircraft, with her knee braced against a cargo strap, and 2 flashlights held by people who weren't medics, and she advanced the needle. The room held its breath in the particular way rooms did when everyone present understood that something irrevocable was happening. Hext stood to her left. He hadn't stepped back. He also hadn't stepped forward. He was doing what she needed him to do, which was stay out of the way without making it obvious that he was staying out of the way. And she appreciated that even if she would never say so. The syringe drew back. Dark blood venous, non-pulsatile. The color and character of pericardial fluid rather than cardiac puncture filled the barrel. She drew off 35 cubic centimeters before sustained, before she felt the resistance change. Pressure, she said. Tommy read it within seconds. 71/42. Not good. Better. She drew off another 15 cc's, slow and controlled, watching the monitor while her hands continued working, and Holloway's heart rate dropped from 138 to 124. And his complexes began to narrow. The electrical signature of a heart remembering how to fill properly. 78/47, Tommy said, unprompted. Mara withdrew the needle, applied pressure, kept her eyes on the monitor. Holloway's saturation was climbing, slowly 81, then 83. Then the pulse ox waveform sharpened and held at 86. Not enough for transport to be comfortable. Enough for transport to be survivable. Or, she said, now. And someone needs to be ahead of us in that elevator. One of the military security personnel at the door was already on his radio. Hext looked at Holloway, then at Mara. He opened his mouth once, then closed it again, which she noted and filed away and didn't comment on. There would be time later for whatever that almost sentence had been. Right now, Holloway needed the elevator, and the elevator needed to be moving. They moved. The hallway outside Trauma 1 was not designed for the controlled chaos of a full trauma transport with military escort. The gurney was wider than the standard clinical gurney because Holloway was a large man, and the flight medics had used a military litter that hadn't been swapped out in the scramble to get him inside. 2 of the IV poles were catching on the doorframe. Tommy was managing the ventilator bag, which meant he was walking backward, which meant he nearly collided with one of the security personnel twice in the first 30 feet. None of it slowed Mara down. She was at Holloway's right side, one hand on the gurney rail, one eye on the monitor clipped to the side rail, calling adjustments to the oxygen flow while they moved and watching the numbers with the sustained attention of someone who understood that stable was not the same as safe, that the difference between the two could close very fast. Beata from the communications desk was holding the elevator. Simpson. The military security man, the older one, the one who had been watching Mara differently from the others, stepped into the elevator first and then held the door with one arm while everyone else loaded. His eyes found Mara's for a moment, and it was the kind of look that didn't require context to interpret. It was the look of someone doing a rapid assessment. Not of the patient, of her. She looked away. Back to Holloway. The elevator moved. Hext was across the gurney from her. In the small space, under the flat, fluorescent light, he looked older than he did on the floor, not because of the light, but because of the particular deflation that happened to people when the situation outran their preparation. And they knew it. Tamponade, he said quietly. Not a question. He was saying it to himself, the way people repeated words that had arrived too fast to process in real time. The fragment angle pointed toward mediastinal structures, Mara said, keeping her voice low, keeping it clinical, because this wasn't the moment for anything else. The pericardium was the obvious secondary's concern, once we had the ultrasound window. I didn't see it on the window. You weren't looking for it yet. A beat. I was about to place the chest tube. I know, she said. She didn't add what both of them understood, that the chest tube, in that position, with that fragment trajectory, would have drained the wrong space while the cardiac tamponade continued unchecked, and Holloway would have arrested somewhere between the trauma bay and the moment anyone realized the intervention hadn't addressed the actual problem. The elevator doors opened on the 3rd floor. The OR team was waiting. The handoff to the OR took 4 minutes, organized, focused, the kind of handoff where people who did this for a living received critical information and acted on it without ceremony. Mara gave the receiving anesthesiologist everything: the pericardiocentesis, the volume drained, the fragment position, the saturation trajectory, the blood product totals from field and floor combined. She gave it in the flat sequential manner of someone accustomed to handoffs that happened under suboptimal conditions and needed to be fast and complete simultaneously. The receiving surgeon, a thoracic attending, named Dr. Yolanda Marsh, who had been pulled from home and had arrived with wet hair, and the focused expression of someone who had left mid-dinner, listened to everything, without interrupting. "Any imaging?" Marsh asked. "No time." Ultrasound window showed tamponade, fragment still in situ, left lateral entry, at approximately the 7th intercostal, trajectory consistent with mediastinal proximity. Marsh looked at the wound, looked at Mara. Something moved in her face, not skepticism, not quite, but the particular evaluation that experienced surgeons did when they were calibrating the source of information against the specificity of the information itself. Who made the tamponade call? I did, Marissa said. Marsh looked at her scrubs, at her name badge, at her face. You're floor nursing? Trauma rotation. And you drained pericardial fluid with a fragment adjacent to the mediastinum and an unsecured airway. The airway was secured in field. And yes, Marsh held her gaze for 2 full seconds. How much did you pull? 50 cc's dark, non-pulsatile. Pressure responded within 90 seconds. Okay. Marsh turned away, already moving, already inside the surgical problem, in the way that surgeons went inside problems when they'd accepted the premise and were moving to solution. Get him prepped, and someone get me a cardiothoracic set. I want the full tray, not the abbreviated kit. The OR doors opened, and Holloway went through them. Mara stopped at the threshold. She watched the doors close. She watched the window in the door as the team moved to position around the table. As the anesthesiologist made his adjustments, as Marsh pulled on her gloves and bent over the patient with the forward lean of someone fully, completely inside the work. Then Mara turned around. Hext was in the hallway behind her. He'd followed them to the 3rd floor. She hadn't registered that until now. He was in his street clothes and the half-on white coat, standing a few feet back with his arms at his sides, and he was looking at the OR doors with an expression she didn't have a clean word for. It wasn't shame, not exactly. It was something more complicated than shame. Shame required a clear accounting of what had gone wrong, and she didn't think Hext was there yet. He was still in the earlier stage. The stage where the numbers didn't add up, and the discomfort of that was larger than the vocabulary available to address it. She didn't say anything to him. She walked past him toward the stairwell because she still had patients on the floor and the shift had 3 hours left, and there was nothing useful she could do outside a closed OR. He didn't stop her. The night finished the way bad nights finished, not with a clean resolution, but with a gradual quieting like a storm that left damage behind it when it moved on. The cardiac patient in Bay 2 had a stable overnight rhythm and was cleared for morning transfer to the step-down unit. The teenager in observation passed his final neurocheck at 3A and was discharged with a concussion protocol sheet and instructions to see his pediatrician within 48 hours. Mara documented everything. She sat at the nursing station at 417A. With coffee that had gone cold, and a screen that blurred slightly if she looked at it for more than 3 minutes without moving her eyes, and she entered her shift notes with the same precision she'd brought to the first note of the night, because the notes were the record, and the record was permanent. And she'd learned a long time ago that the record was sometimes the only thing that remained when everything else got complicated. Tommy came by at 4:30 to refill his own cup and stopped beside her. "How are you doing?" he asked. It was a real question, not the performed version. "I'm good," she said. That was... He stopped. "Try it again. I've never seen a bedside pericardiocentesis on a trauma patient. Hopefully you won't see a lot of them." "Did you learn that in your residency?" She looked at him. Tommy was young in the way that made his face an open record of everything he was thinking. And what he was thinking right now was a genuine, uncomplicated curiosity, with none of the territorial defensiveness that questions like this carried when they came from other directions. "Something like that," she said. He nodded, accepting the non-answer without pressing it, which was one of the things she appreciated about him. He refilled his cup and went back to his station. She went back to her documentation. At 5:50 a.m., 10 minutes before the day shift started to arrive, Danielle appeared at her elbow with a look on her face that Mara had not seen from her before. It wasn't hostility. It wasn't the managed authority she normally carried. It was something less composed than either of those things, and it made her look temporarily younger. "Holloway's in recovery," Danielle said. "Marsh got the fragment out. He's off the vent." Mara exhaled through her nose. "Good. She flagged your intervention in her OR report." Danielle paused. She called the pericardiocentesis, call her word accurate. Mara said nothing. She also asked who authorized it. I did, Mara said. Dr. Hext was present and did not object. Danielle looked at her for a moment. There's going to be a review, she said. I know. Not the kind you're thinking. Danielle's voice shifted a fraction, lost some of its managed quality. The military is involved, Mara. That patient is not a civilian. The people downstairs, those aren't regular security. I've been on the phone with administration since 2 a.m., and there are things happening above my level that I don't have clearance for. Mara looked up from her screen. What kind of things? I don't know. That's what I'm telling you. Someone from a federal coordination office called the hospital director at 3 a.m. They wanted a full account of the clinical interventions on Holloway. Every decision, every provider, every timeline. Danielle held her gaze. They specifically asked about the nurse who performed the pericardiocentesis, the break room down the hall, the lockers, the worn cord, and the flat weight against her sternum. Okay, Mara said. Do you know why? Mara looked back at her screen. No, she said. It wasn't entirely a lie. She didn't know which specific thread they were pulling. She only knew that threads existed, that they connected to a part of her life that Harwell Memorial didn't know about, and that she had maintained carefully and deliberately as a separate geography. A place she no longer lived, but had not fully left. The way places you've survived tend to stay attached to you, regardless of how far you walk from them. She closed out her documentation, logged off the system, and went to collect her things. She was at her locker when the older military security man found her. Not found that wasn't right. He had walked to the nursing locker room with a specific destination in mind, which meant he'd asked someone where it was or already knew, and either way the word found didn't apply to a man moving with that kind of intentionality. He knocked on the open door. Ellison. She turned. He was in his 40s, with the kind of physical economy that came from years of using a body as a working instrument rather than an aesthetic one, and the rank insignia on his collar, which she registered and processed in about a second and a half, told her he was a senior non-commissioned officer, Special Operations Branch, which was a specific and narrow category of person. I'm Sergeant Major Dale Vickers, he said. I was on the aircraft with Commander Holloway. I'm sorry, she said. That must have been difficult. Vickers looked at her in a way that suggested he wasn't there for small talk and had noticed she wasn't really offering it. I need to ask you something, he said. All right. How did you know about the tamponade before the ultrasound confirmed it? Mara set her jacket over her arm. The fragment trajectory suggested mediastinal proximity. Combined with the vital sign pattern and the rhythm changes, tamponade was the most likely explanation for why his pressure was falling faster than his visible blood loss could account for. You read the trajectory from the entry wound. I made an inference. The ultrasound confirmed it. Vickers was quiet for a moment. He was looking at her the way the older military man in any room eventually looked at certain kinds of people with the evaluation that wasn't about credentials or titles, but about something to name and harder to fake. The flight medic who brought him in, Vickers said. She said you asked about the aircraft failure mode. I asked whether it was mechanical failure at altitude. Why? Because altitude and mechanical failure change the body position at moment of impact. Body position changes the entry angle. Entry angle tells you more than the wound site alone about where the fragment traveled. Another pause. Where did you learn to think like that? Flight medic training, Mara said. It teaches you to reconstruct the mechanism before you treat the injury. The word reconstruct sat in the air between them for a beat longer than it needed to. Vickers nodded. Slowly. Holloway's going to make it, he said. Marsh told us 20 minutes ago. I heard. I'm glad. He looked at her once more, that same evaluative look, and then he said something that she had not expected. There's a man who's going to want to speak with you. When Holloway is stable enough to have visitors, he asked specifically. Vickers reached into his breast pocket and set a card on the edge of the locker shelf. "If you're willing." Mara looked at the card. It had a phone number and a name, and the name was not a name she recognized. But the organizational identifier beside it was one she recognized immediately and had not seen in 3 years. She didn't pick up the card right away. "I'm a civilian," she said. "I know. I work in a hospital in Spokane." "I know that too." Vickers moved toward the door, then stopped. "The man whose chest you opened 6 minutes after he served with people who know your name. That's all I'm saying." He paused at the threshold. "The card's just a number. Nobody's asking you for anything you haven't already given tonight." He left. Mara stood alone in the locker room for a moment. Then she picked up the card and slid it into her jacket pocket without reading the number again. She already had it memorized. Old habit. She slept 4 hours, which was approximately what her body required to stop making errors of the type she couldn't afford. She was back at Harwell by noon, not because she was scheduled, but because a message from Danielle had arrived at 10:47 a.m. and marked urgent, and the word urgent from Danielle at that particular hour of the morning on that particular day was not something she was going to ignore from a distance. The administration wing on the ground floor of Harwell Memorial was separated from the clinical floors by a corridor that smelled like carpet cleaner and institutional ambition, the kind of hallway that existed in every large hospital in every medium-sized city, carpeted where the clinical floors were not, lit slightly warmer, hung with motivational language in sans serif fonts about excellence and community and patient-centered care. Mara had walked it twice before in her 6 weeks at Harwell, both times for onboarding paperwork. She walked it now and stopped at the office of hospital director Garrett Pohl. Pohl was 61, a healthcare administrator who had come up through finance rather than medicine, which meant he understood institutions the way clinicians sometimes didn't, as organisms that prioritize survival above almost everything else. He was not cruel. He was cautious in the particular way that people became cautious when they'd spent decades managing the gap between what institutions said they valued and what they actually protected. He stood when she came in, which surprised her. "Ms. Ellison, thank you for coming in." He gestured to a chair. "Please sit." She sat. Danielle was in the room, standing near the window. Also present, a woman Mara didn't recognize, mid-50s, in a dark blazer with the contained expression of someone accustomed to rooms where information was being managed. "This is Miss Audra Felt," Pohl said. "She's a liaison with the Federal Coordination Office that contacted us this morning." Mara looked at Felt. Felt looked back without offering anything in her expression. "I understand there are questions about last night's interventions," Mara said. "There are," Pohl said, "but not the kind I think you're anticipating." He cleared his throat. He was managing something. Dr. Marsh submitted her OR report this morning. It's been reviewed. The tamponade diagnosis and intervention are both documented as clinically appropriate and decisive. "Okay," Mara said. "The incident reports filed by Dr. Hext earlier in the evening are also under review." Pohl paused. "In light of the Gerald Peck case and the timeline of your documented clinical concern at 8:33 p. A concern that was validated by subsequent surgical findings, the hospital is conducting an internal review of the incidents as a pattern rather than as isolated events." "A review of the incidents," Mara said carefully, "or a review of whether the incidents were warranted." Pohl looked at her. "Both," he said. Felt spoke for the first time. Her voice was level, practiced, the voice of someone who delivered complicated information for a living. "Ms. Ellison's, the patient transported to your facility last night is a federal asset. His care and the documentation of that care are subject to oversight by an interagency medical review panel. The panel has already received Dr. Marsh's report. They've also requested documentation of all clinical personnel involved in Commander Holloway's care, from point of entry through OR handoff." "All right," Mara said. That documentation will include the pericardiocentesis, the clinical record, Dr. Marsh's notation, and the testimony of personnel present. Felt paused. The review panel is going to have questions about your training background. Mara looked at her hands, which were resting on her knees, relaxed. My training background is in my personnel file set, she said. Your nursing credentials are. Yes. Felt's voice didn't change. The review panel is going to ask about other training. The room was very quiet for a moment. Danielle, near the window, was looking at the carpet. Pole was looking at the surface of his desk. Mara looked at Felt. What kind of timeline are we talking about? Mara asked. The panel convenes in 72 hours. We'd ask that you remain available and that you not discuss the specifics of last night's case with colleagues until the review is complete. And the incident reports from Hext? Felt glanced at Pole. Pole said those are on hold pending the outcome of the internal review. Mara stood. I'll be available, she said. You have my number. She walked out of the office and back down the carpeted corridor. She passed the sans serif excellence quotes and the framed photographs of smiling patients in rooms that looked cleaner than any patient room she'd ever actually worked in. And she walked back through the doors to the clinical floor, where the smell changed immediately to antiseptic and floor wax, and the ambient, low-grade urgency of a place where people were sick and time was not abstract. She had 72 hours. She thought about the card in her pocket. The number. The name beside the organizational identifier she'd recognized. She thought about what Vickers had said, a man who wants to speak with you. She thought about Commander Holloway in recovery off the vent, alive, his chest sutured closed over a repaired pericardium and an extracted fragment that had spent several hours wedged against structures that didn't tolerate that kind of proximity. She thought about the dog tags under her scrub top. The weight of them, the temperature of the metal, always slightly cooler than her skin no matter how long she wore them, as though they were determined to remain separate from the body they traveled with. She turned the corner toward the nursing station. Hext was there. He was standing at the counter, not writing, not reading, just standing in a way that looked like waiting without the intention of making it obvious that he was waiting. When he saw her, something crossed his face, not the controlled professional neutrality he usually carried, but something less rehearsed than that. Ellison, he said. She stopped. I read Marsh's report, he said. She waited. He looked like he was choosing words, with more care than was natural for him. It was the look of a man working against his own grain, which she supposed was the most she could fairly expect. The fragment angle, he said. You read that from the entry wound. I made an inference based on the injury mechanism. Where does that kind of inference come from? She looked at him, at his face, which was complicated in a way she hadn't seen it be before. Not complicated because he was pretending, but complicated because he genuinely wasn't sure what he was looking at, and it was making him reckon with something he'd decided without enough information. She thought about telling him. Not everything, not the aircraft and the cargo strap and the flashlights, not the 18 months in environments that didn't appear on maps, but enough. Enough to answer the question he was actually asking. She decided against it, not because she owed him ignorance, because she wasn't ready for this hallway to be the place where that conversation happened. And because she needed to think about the review panel and the 72 hours in the card in her pocket before she decided what else she was going to say to anyone. Flight medic training, she said. It teaches you to work with what you can observe. Hext held her gaze. The incident reports, he said. Both of them. I'm going to speak with administration. I know, she said. Pole mentioned the review is pending. I'm going to speak with them about withdrawing the second one. He stopped. Started again. The PEC call. You documented it at 8:33. The surgical findings validated your concern. I should not have. He stopped again? She waited. I should have listened, he said. It was 3 words, and it cost him something to say them, which she could see, and she didn't take any particular satisfaction in seeing it, because satisfaction required energy she didn't have. "Thank you," she said. She walked past him to the nursing station and sat down. Her screen came on, the patient board loaded. 3 active cases on her rotation, 2 flagged for monitoring, 1 pending discharge. She started reviewing the first chart. She was 3 minutes into it when her phone buzzed. Not a Harwell notification. Her personal cell in her jacket pocket. She pulled it out. Unknown number. But the area code was one she recognized, not because she'd called it recently, but because she had spent 14 months in a place where that area code was how the outside world reached in. She looked at the screen for a long moment. Around her, the morning shift was settling into its rhythms, the rolling of carts, the cadence of monitors, the overlapping conversations of a floor that had processed a difficult night and was already building the architecture of the next 12 hours on top of it. Mara stood up from the nursing station. She walked to the stairwell door, pushed through it, let it close behind her in the particular concrete silence of a hospital stairwell, and answered the call. The voice on the other end said her name. Not her first name. No. Ellison. The other name, the one that appeared on no Harwell personnel file, that had not been spoken aloud in 3 years, that belonged to a version of her that she had put in a drawer and mostly kept closed. The voice said, "We have a situation, and Holloway asked for you specifically. There's a reason his fragment was where it was, and it wasn't an accident. We need you to hear what he has to say before the review panel convenes, because what's coming in 72 hours is bigger than internal investigation, and you're already in the middle of it, whether you want to be or not." Mara stood in the stairwell with her back against the concrete wall and her phone pressed to her ear, and outside the door she could hear the muffled rhythms of the floor she worked on, the hospital she had come to 6 weeks ago to be a nurse and nothing else. She closed her eyes once. Then she said, "Tell me what happened to Holloway." The voice belonged to a man named Reeve Callahan. She didn't know him by that name. She knew him by a call sign she hadn't heard spoken in 3 years, and in hearing his actual name and his actual voice, without the compression and static of field communications, was disorienting in the specific way that things from sealed-off parts of your life were disorienting when they surfaced without warning into ordinary air. "Callahan's," she said. "You remember." "I remember everything," she said, which was both true and not a comfort. He didn't waste time. Callahan had never wasted time, which was one of the reasons he'd been good at what he did, and she supposed still was. He told her that the training exercise that had put Holloway on her table had not been a training exercise. Or rather, it had begun as one and stopped being one approximately 40 minutes before Holloway's aircraft declared the emergency. There had been a structural failure in the aircraft, which was documented and real, but the failure had been preceded by something that the investigation team was still characterizing. What they knew was that a fragment from a device, not a training device, had penetrated the aircraft fuselage at low altitude before the structural failure occurred. "Someone put a device on that aircraft," Callahan said. "How close is the investigation?" "Close enough that the people responsible know it's close. That's the problem." He paused. Holloway was running an asset. Someone in the program didn't want him to keep running her. The accident was meant to look like equipment failure. It mostly did, until you pulled 50 cc's of blood from his pericardium, and he survived. Yes, his voice had the dry quality of someone recounting things that would have been darkly funny under different circumstances. He's awake. He's been awake for 2 hours. And the first thing he asked for, before he asked for a status report, before he asked for his team, was you. Mara said nothing for a moment. The stairwell was cold in the way institutional concrete was always cold, holding the temperature of some earlier season that the heating system hadn't fully displaced. From above her, 2 floors up, she could hear the muffled sound of a door opening and closing, footsteps, the ordinary percussion of a working hospital. "Why me specifically?" she said. He said, and I'm giving you his words, she reads the injury the way we read terrain. Get her in here before the panel convenes, because there's something she needs to hear that I can't put in a formal report. She pressed her back harder against the concrete. He knows who I am, she said. It wasn't a question. He's known since before he landed on your table. He recognized the hospital's location in the flight plan. Said it was either a coincidence or it wasn't, and he doesn't believe in coincidences. Callahan's voice shifted, lost a fraction of its professional neutrality. Neither do I, for what it's worth. I'm a nurse in Spokane, she said. You were a flight medic in a lot of places that didn't have names, he said. Past tense doesn't erase the operational record, Mara. And somebody who isn't us may already know you were on that floor last night. The word somebody landed with weight. She looked at the concrete wall across from her, at the fire extinguisher bracket and the emergency's lighting fixture and the painted number indicating floor level, all the ordinary infrastructure of a place designed to process crisis and keep its own structure intact while doing so. How long does Holloway have before they move him? She said. Transport is scheduled for 1,800 hours. Military medical facility outside Tacoma. He paused. That gives you roughly 5 hours. And you want me to go in there and hear whatever he wants to tell me. I want you to do whatever you decide to do, Callahan said. I'm not asking for operational commitment. I'm delivering a message. She exhaled. Where is he? Recovery Room B, on the 3rd floor of Harwell Memorial, was a 4-bed unit that currently had 2 patients in appendectomy recovery on the far left and Commander Brant Holloway on the far right, separated by a curtain that provided visual privacy but not acoustic privacy, which was probably why the 2 military security personnel outside the door had supplemented themselves to positioning themselves to intercept anyone approaching Holloway's bed before they got within conversational range. Vickers was one of them. He saw Mara coming and stepped aside without speaking, which told her Callahan had made a call between the stairwell and the 3rd floor. She pushed through the curtain. Holloway was not what she'd expected, which was itself a reminder that she needed to stop expecting things, because expectations were assembled from incomplete data and they narrowed vision in ways that mattered. He was 42, she learned later, though he looked older right now, not from age, but from the specific physical toll of major thoracic surgery layered on top of the baseline attrition of a career spent doing things that bodies weren't designed to do repeatedly. He was off the vent, breathing on supplemental oxygen through a nasal cannula, with a chest drain still in place and 2 peripheral IVs running maintenance fluid at a rate that told her Marsh's team was being conservative with volume, which was right. His color was poor, the gray-tinged pallor of serious blood loss that wouldn't fully resolve for days, but his eyes were clear and tracking, which was the relevant metric. He was watching her come through the curtain. Ellison, he said. His voice was rough from the tube. Commander. She pulled a stool to his bedside and sat down, keeping her voice low. How's your breathing? Hurts, he said. It will for a while. Marsh did good work. I heard you did better work. Before she had a chance. He paused, breathed carefully the measured breath of someone who had already learned that incautious inhalation was a bad idea. You stopped Hext from moving the fragment. The tamponade was the more immediate problem. Callahan said you read the trajectory from the entry wound. I made an inference. Holloway looked at her. His eyes were sharp in a way that had nothing to do with his current condition, the sharpness of sustained assessment, the look of someone who had spent years reading people in rooms where reading them incorrectly had consequences. You're going to keep saying that, he said. The inference. It's accurate. It's also what you say when you don't want to explain where the inference comes from. He breathed again, carefully. I know your operational record, Ellison. I've known it for 2 years. I was the one who signed the waiver that let you separate quietly instead of getting pulled back in for a debrief that would have kept you in the system another 18 months. She went still. She hadn't known that. She had known that her separation had been smoother than it should have been given the circumstances, the timing, the incomplete debrief, the administrative paperwork that had resolved itself with unusual speed. She had attributed it to institutional indifference. The machine processing her exit because she'd requested it and because her last operational record was clean enough not to require additional review. She had been wrong about that. Why? She said. Because you'd earned it, he said simply. 14 months in theater, 4 personnel you kept alive, that the casualty HUD projections had already written off. The last one was a 23-year-old with a pneumothorax and a femoral bleed who made it home and is currently coaching his kids' soccer team in Minnesota. He paused. You were done. I could see it. So I signed the waiver. The recovery room was quiet around them, the soft cycling of monitors, the faint beeping from the other bed, the distant sounds of the hospital beyond the curtain. What do you need to tell me? She said. He shifted, which cost him. She could see the tightening around his eyes, the controlled management of pain, the breath held and released deliberately. The device on the aircraft. We know the target was me. What we don't know yet, what the investigation needs to establish before the review panel convenes, is who in the program had access to the flight plan. That's an internal investigation. Yes, but it intersects with something external. He looked at her directly. The asset I was running. Her name's not important. What's important is that she's been passing information about a supply chain operation that someone very much doesn't want investigated. We've been building the case for 8 months. He paused. 3 weeks ago, I submitted a request to bring in a civilian medical specialist to evaluate her condition. She's been injured not operationally, domestically. The kind of injury pattern that has a specific language. Mara understood what he meant. She didn't say so yet. The request went through a routing system with limited access. Holloway continued. 48 hours after the request, the flight plan for our training exercise was modified to include the aircraft that failed. He held her gaze. Somebody read my specialist request and made a connection I hadn't intended to make visible. They thought you were moving her. They thought I was about to move her to somewhere safe before the investigation completed, which would have changed the timeline and complicated their options. He breathed. They weren't entirely wrong about my intentions, just wrong about the timing. Mara looked at the drain coming from his chest, the tubing, the collection chamber, the controlled evidence of a body still resolving the trauma done to it. She thought about the fragment angle, the trajectory, the specific geometry of a device positioned to create maximum internal damage while appearing externally consistent with equipment failure. Someone had done this deliberately and with specific knowledge of how Holloway moved and where he would be. What do you need from me? She said. The specialist request, Holloway said. I need someone to evaluate her, clinically, formally. Someone whose involvement can't be traced through the program's medical clearance system because they're not in the system. He held her gaze. Someone who knows how to read an injury pattern and document it in a way that holds up under formal review. The room seemed to tighten. You want me to do a clinical evaluation for a federal investigation, she said. I want you to examine a woman who's been hurt, document what you find, and provide that documentation to an investigation that is trying to stop the people who put a device on my aircraft. His voice was careful, direct, exhausted in the way of a person who had already spent significant energy on the conversation and had more ground still to cover. It's a medical examination. It's what you do. It's what I do in a hospital with charting systems and colleagues and legal coverage, she said. I know what I'm asking, do you? Yes. He didn't look away. I also know what I'm not asking. I'm not asking you to go back. I'm not asking for operational commitment. I'm asking you to look at a patient and tell me what you see. The way you looked at my wound last night and told Hext what he was about to do wrong. The way she had done it without thinking, because some things were past the point of decision, they were just response, the body acting on training so deep it had become indistinguishable from instinct. She looked at her hands. When? She said. Today, he said. Before 1800, before I'm transferred and before the panel convenes. He reached toward the small table beside his bed, a careful, managed movement that pulled at the drain and made him pause, and retrieved a folded piece of paper. Address. Contact name. She's been told someone is coming. Mara took the paper. She looked at it. The address was in Spokane, 20 minutes from the hospital. The contact name was a woman. She knows to expect a nurse? Mara asked. She knows to expect someone who can be trusted, Holloway said. I told her that's the same thing. She left the hospital at 1:15 p.m. She drove her own car, a 9-year-old Subaru, with a cracked dashboard and a heating system that worked well on the driver's side and uncertainly on the passenger side, and she drove it through the ordinary midday streets of Spokane under flat. Winter light through neighborhoods that looked like every other neighborhood in every other mid-sized American city, the visual grammar of strip malls and traffic signals, and the occasional bare tree gesturing at some prior season. She was thinking about the paper in her jacket pocket. She was also thinking about the review panel, the 72 hours. Felt's careful voice telling her that what was coming was an interagency review of her clinical interventions, which she had taken at face value in Pohl's office, because at the time she had not yet spoken to Callahan and had not yet known that Holloway had been targeted and that a case 8 months in the building was balanced on whether the people dismantling it could be identified and stopped before they identified the asset and moved first. The stakes were different now. She pulled into the address on the paper, a residential block, a white house with a small porch, a car in the driveway that looked recently moved, and sat in her Subaru for 30 seconds with the engine off. She thought about the 23-year-old in Minnesota coaching youth soccer. She got out of the car. The woman who answered the door was named Sona Dravets. She was 36, dark-haired, with the carefully assembled appearance of someone who had put effort into looking composed and nearly succeeded because the effort itself was visible to anyone trained to see it. The extra degree of stillness that wasn't natural ease but managed presentation at a particular angle. The hands held at a particular angle that distributed weight away from the left side of the torso. You're the one he sent, Sona said. Yes. Sona stepped back to let her in. The house was clean, sparsely furnished, the furniture of someone who either lived minimally by nature or had not been here long enough to accumulate the ordinary accretion of objects that made spaces look inhabited. Mara noted the sight lines from the front door, the position of the windows, the lack of photographs on the walls. She did this automatically, without deciding to. I'm going to need you to sit down, Mara said, and I'm going to need to ask you some questions first, before I do anything clinical. Is that all right? Sona sat. Mara sat across from her. She asked about the timeline. When the injuries had begun, not this injury, the pattern. Because what Holloway had described and what the angle of Sona's held posture confirmed before Mara had asked a single clinical question was not a single event. It was a pattern, repeated, calibrated, designed to remain below a threshold of visibility, below the line where someone might look closely enough to document. Sona talked. She talked for 20 minutes with the specific precision of someone who had been holding information carefully for a long time and had learned to release it in controlled portions because releasing too much at once had consequences. Mara listened without interrupting. She built the timeline in her head, the dates, the nature, the escalation pattern, the deliberate selection of injury sites that clothing covered and that casual examination wouldn't surface. Then she conducted the examination. She was thorough. She was clinical. She used the precise observational language she'd been trained in, first in a nursing program that had itself been more rigorous than standard, and then in contexts that had required even more precision, because imprecision in a field setting had immediate and uncorrectable consequences. What she found was worse than what she'd expected. Not because the injuries were singular or dramatic, they weren't. They were the opposite, incremental, distributed, the kind of damage that accumulated beneath a surface presentation of functional normalcy, invisible unless you knew what sequence to look for and how to interpret what you saw. She documented everything. She used her phone clinical photographs, dated, time-stamped, taken with the particular angles that captured depth and distribution rather than just surface appearance. She wrote notes in the systematic she'd used for field medical records, the format that held up under formal review, because it was specific, sequential, and reproducible. She was 40 minutes into the documentation when Sona said, "Do you know what they'll do if this gets out before the investigation is finished?" Mara looked up. "They'll try to make it stop," she said. "That's why it needs to be documented completely before anything else happens. And you trust that the documentation will be enough." "I trust that the documentation is the thing that makes everything else possible," Mara said. "It's not the same as trust in the system. It's trust in the record." Sona looked at her with the assessment of someone who had learned to evaluate trust the hard way. "You've done this before," Sona said. "It wasn't really a question." "Different circumstances," Mara said. "Same principle." She finished the documentation. She transferred everything photographs, written notes, timeline to encrypted file, using an application she had not opened in 3 years and had never deleted, because she had known, with some part of herself, she hadn't been able to argue out of knowing it, that the day might come when she would need it. She sent the file to Callahan. Then she sat back in the chair across from Sona and felt the particular weight of having done something that couldn't be undone. Not because she regretted it, but because irreversibility had a specific texture that was distinct from the texture of reversible choices, and she had enough experience with both to tell them apart. "What happens now?" Sona asked. "The investigation uses this to establish the pattern formally. Combined with what Holloway was building, it changes the evidentiary position." She paused. "They'll move you. Probably today. Will it work?" "I don't know," Mara said. "But it's better than the alternative." She drove back to Harwell. She had 2 hours before Holloway's transfer. She went back to her rotation, back to the patient board, back to the ordinary work of a floor that had processed an extraordinary night, and was now asking her to show up for the ordinary part, which she did, because showing up for the ordinary part was what kept the extraordinary from consuming everything. She was at the nursing station at 4:40 p.m. when her personal cell buzzed. Callahan. She stepped into the stairwell again, the same stairwell, the same cold concrete, the same distant percussion of a working floor above her. "I got the file," he said. "Good. The panel has been moved." His voice had changed. Not alarmed, Callahan did not alarm easily, but compressed. The particular compression of a man managing something fast-moving. "They're convening in 6 hours, not 72. She pressed her hand against the concrete wall. "Why?" "Because someone flagged the clinical review of your interventions to a member of the panel, who has a connection we're still running down. And now they're moving the timeline up." He paused. "Which means the review of your background happens before the investigation has the documentation in informal evidence." She understood what he was saying. If the panel convened before the investigation formally incorporated her documentation, the review of her background would happen in a vacuum, without the context of why she had been at Harwell, without the context of Holloway's case, without the context of what the documentation of Sona's injuries meant to the larger investigation. In that vacuum, the panel's questions about her training and her interventions would look like exactly what they were being framed to look like. A civilian nurse operating outside her scope, covering something up. Her military background, a liability rather than an explanation. Someone on the panel was working against the investigation, and they had just moved the clock forward to make sure the record was shaped before it could be corrected. "I need to know one thing," Mara said. "Ask it. The person who flagged my clinical review. Do we know who they are? A pause. We have a name, Callahan said. But it's going to complicate things significantly when it becomes visible. Because the name is connected to the hospital. She went cold in a way that had nothing to do with the concrete or the temperature. Connected how, she said. Connected as in employed by, Callahan said. Connected as in someone who has been at Harwell Memorial for 11 years and who processed your personnel intake when you joined 6 weeks ago. The stairwell was very quiet. She thought about her first week. The onboarding paperwork, the desk where she'd handed over her credentialing documents and her nursing license and the carefully curated employment history that was true in every detail it contained, and Sexton silent about everything it did not. She thought about Danielle Crow handing her the disciplinary form. Danielle saying someone from a federal coordination office called the hospital director. Danielle's voice when she said there are things happening above my level that I don't have clearance for. Tell me the name, Mara said. Callahan told her. She stood in the stairwell, with the phone pressed to her ear, and the name sitting in her mind like something that had always been there, and she simply hadn't looked at directly. And outside the door, the hospital moved in its rhythms, and Commander Holloway was upstairs in recovery room B, with 2 hours until his transfer, and the panel was convening in 6 hours, and the file she'd sent to Callahan was encrypted, but not invisible. And somewhere in this building, a person who had known who she was. From the moment she walked through, the intake desk was making calls that were designed to ensure she didn't have a chance to explain herself before the record was written without her. She ended the call. She pushed open the stairwell door. She walked out onto the floor, past the nursing station, past the patient board, and directly toward the office at the end of the clinical corridor, where she had been told 6 weeks ago that she would find the charge nurse if she ever had questions about scheduling or patient assignments. Danielle Crow looked up from her desk when Mara appeared in the doorway. And in the fraction of a second before Danielle composed her expression into its customary managed authority, Mara saw it, the flicker, the calculation, the specific look of a person who has just registered that something they expected to have more time on has arrived ahead of schedule. Ellison, Danielle said. What can I know about the flag? Mara said. And I know about the panel. Danielle's face went completely still. And I have 60 seconds of patience left, Mara said. So you need to tell me who you've been talking to. Danielle didn't answer right away. That itself was the answer. In the way that a person's first response to an accusation told you more than anything they said afterward. Not guilt necessarily, but the specific calculation of someone deciding how much they could still control by choosing their words carefully. Mara had seen that calculation before. She recognized the half-second of stillness, the slight elevation of the chin, the eyes that moved once to something behind Mara's left shoulder before coming back to her face. Danielle was checking whether it was in the hallway. Close the door, Mara said. Danielle didn't move. Mara reached back and closed it herself. I don't know what you think you know, Danielle said. I know you flagged my clinical interventions to a panel member before the formal review process. Mara kept her voice level, not raised, because raised voices in a hospital office carried through walls, and she needed this conversation to happen in the room it was in. I know the panel timeline was moved up after that flag. And I know that you processed my personnel intake 6 weeks ago, which means you saw my credentialing documents before anyone else in this building. Danielle's face was doing something complicated. The managed authority she normally wore had cracked along a line that Mara hadn't seen before, and underneath it was something that looked less like guilt than like a person who had been managing something heavy for a long time and was very tired. You don't understand what you're in the middle of, Danielle said. Then explain it to me. I can't. Can't or won't. Danielle looked at her hands. They were flat on the desk, which was a conscious placement, the kind of deliberate stillness that people adopted when they were trying not to show what their hands were doing. How long have you been working with them? Mara said. A pause. I'm not working with anyone, Danielle said. I was contacted 3 weeks ago, before Holloway. She stopped. Started again. Someone called the hospital's credentialing line and asked specific questions about a new hire in the trauma rotation. They had details that weren't public record. Your name, your start date, the rotation assignment. She looked up. They knew you were here before I confirmed anything. I didn't give them your file. I confirmed you existed. And last night, another pause. Longer. They called again after the military transport landed. They wanted to know the scope of your interventions, whether you'd performed anything outside your documented scope of practice. Danielle's voice was flat. The flatness of someone reporting facts they had already exhausted their emotional response to. I told them about the pericardiocentesis. I told them Marsh had flagged it in her report. Mara looked at her. Did you know what they were going to do with it? Danielle stopped. I thought they were a regulatory body. The language they used sounded like oversight, like they were monitoring a credentialing irregularity. They used regulatory language, Mara said. Yes. And you didn't verify who they were before you gave them clinical information about a patient's care. The sentence landed. Danielle absorbed it with the stillness of someone taking a hit they knew was accurate and had no defense against, because the defense would require admitting that she had wanted to believe the story she'd been given, that it had been convenient, that the credentialing irregularity narrative had given her a framework she could use to explain to herself why she was providing information that, outside that framework, she had no legitimate reason to provide. No, Danielle said quietly. I didn't verify. Mara sat down in the chair across from the desk. Not because she needed to sit, but because standing over Danielle right now would turn this into something. It didn't need to be a confrontation between two people when what Mara needed was information and what Danielle needed was to understand that the path forward required her to give it. I need the number they called from, Mara said. Both calls. Danielle opened her desk drawer. She stared into it for a moment, then pulled out a small notepad, the kind that charge nurses used for shift notes, spiral-bound, the pages dense with the handwritten shorthand of 12-hour shifts. She flipped back several pages. The first call. I wrote it down because the direct line they used was unusual. I was going to look it up, and I didn't. She slid the notepad across the desk. Mara looked at the number. She photographed it with her phone. The second call, she said. Same number. She pushed the notepad back. You need to write a statement, Mara said. Everything you just told me. Timeline, what they asked, what you told them. Exact language as best you can recall. Do it now, before the panel convenes. If I do that, if you don't, you're the person who provided clinical information to an unknown party for an investigation that isn't what it claimed to be. That's a HIPAA violation at minimum and potentially obstruction of a federal investigation. Mara held her gaze. If you do it, you're the person who was deceived. Documented what happened when you under the deception and cooperated with the legitimate investigation. Those are very different positions. Danielle looked at the notepad, at her hands, at the door behind Mara. I was trying to protect the hospital, she said. I know, Mara said. She meant it. That doesn't change what you need to do right now. She stood up. Write the statement. I'll be back in 40 minutes. Don't talk to anyone else in the building until then. She left the office. The number traced to a prepaid routing service within 6 minutes of Mara forwarding it to Callahan, which told her two things. That the people who had called Danielle were careful enough to use routing, but careless enough to use the same number twice, which was the kind of operational sloppiness that happened when someone was working a parallel operation on a compressed timeline and prioritizing speed over hygiene. Callahan called her back while she was walking the outer corridor of the third floor, keeping her voice low, keeping her face neutral for the benefit of anyone watching who would see a nurse on a phone call and nothing else. The routing service is registered to a shell company, he said. But the shell has a parent, and the parent has a board, and 2 of the board members have names that appear in the investigation file. He paused. We're getting close. The panel convenes and she checked. 5 hours, 20 minutes. I know. I'm working the timeline from this end. But I need you to do something. His voice shifted. The panel has 7 members. We have confirmation that one of them is compromised. What we don't have is documentation of the mechanism, how the flag traveled from the hospital to the panel member. If Crow's statement establishes that chain, it changes the panel's internal authority significantly. I'm getting the statement, Mara said. There's something else. A pause that had weight to it. Holloway wants to speak to the panel directly before transport. He's requesting an emergency pre-panel hearing, not the full review, just a preliminary session where he can introduce his operational evidence on record before they convene without him. Callahan's voice was careful. His transport surgeon cleared him for a 30-minute bedside session, if the panel agrees. But the request has to come through the hospital's coordination office, and the hospital's coordination office runs through Pole. Pole will approve it if I ask, Mara said. You're sure? She thought about Pole's office, about the way he'd stood when she came in, which she'd noted as unusual and now understood as a man already managing more information than he'd expected to be managing, and responding to it with the instinct to be careful. I'm sure enough, she said. Give me 20 minutes. She went to Pole's office. His assistant started to tell her he was in a call. Mara said it was urgent and clinical and related to the Holloway case. And the assistant looked at her face and made a decision that experience suggested was right, which was to interrupt the call. Pole came out in under 3 minutes. She told him what she needed. Not everything, not Callahan, not the investigation, not Sona Dravets, or the supply chain operation, or the 8 months of case building. That was balanced on whether the next 6 hours resolved correctly. She told him that Holloway was requesting an emergency preliminary session with the review panel before transport, that his surgeon had cleared it, and that the session was necessary to ensure the panel had complete information before conducting a review of clinical events in which a federal patient was directly involved. Pole looked at her. You're telling me there are things the panel doesn't know yet, he said. I'm telling you that Commander Holloway has requested the opportunity to provide his account before the panel convenes without him, she said. That request is reasonable and he's medically cleared to make it. Pole was quiet for a moment. Felt's office needs to approve the format, he said. Then call Felt's office, Mara said. I'll wait. He made the call in front of her, which she appreciated not because she didn't trust him, but because watching the call told her things that not watching it wouldn't. Felt's office approved the format in 4 minutes. The preliminary session was scheduled for 6 p.m. 1 hour before the full panel was due to convene, which gave Holloway 30 minutes by bedside and gave Callahan's team the window they needed to get the routing documentation into the formal record before the panel sat. Mara went back to Danielle's office. The statement was written. 4 pages, longhand, the handwriting of a person who had worked through the discomfort of putting things down and arrived at a specific kind of clarity on the other side. Not relief, exactly, but the particular settle of someone who had stopped managing a weight by carrying it alone. Mara read it twice, noted 3 places where the detail was insufficient, asked Danielle to expand them, and waited while she did. What happens to me? Danielle asked, not looking up from the page. That's not my determination, Mara said. But the statement helps. That's not the same as saying it's fine. No, Mara agreed. It's not. Danielle finished the additions. Mara photographed all 4 pages and forwarded them to Callahan. Then she went back to her rotation, because there were patients on her board, and they did not know or care about review panels or prepaid routing services or the particular geometry of an investigation that had been building for 8 months and was now in its final hours, and their not knowing was not a problem she could solve for them, but their vitals and their medications and their comfort were things she could address, and so she did. At 5:15 p.m., Dr. Hext found her at the medication cart outside Bay 3. She had not seen him since professionally, not seen him since the hallway conversation that morning, when he had said note with the effortful precision of a man working against his own grain. He looked different now, still in his street clothes. The white coat gone, which meant he wasn't technically on shift. He had come back to the hospital without a clinical reason. "I heard the panel was moved up," he said. "Word travels," she said. "Pole called me. He wanted my account of the overnight interventions." He paused. "I told him the pericardiocentesis was the correct intervention, performed with appropriate urgency, and that my role was to support rather than lead the procedure once the clinical picture was established." She looked at him. "Is that accurate?" she said. "It's what happened," he said. Framed charitably toward both of us, but accurate. She went back to the medication cart. "The incident reports," he said. "Both of them. I've formally requested withdrawal from the personnel file. The PEC documentation supports your clinical judgment in the second incident." He stopped. "The second incident was filed before I had complete information about the situation. That's a polite way of saying I was wrong, and the paperwork should reflect that." She counted the medication tabs into the cup. "Accurate count, first time." "Thank you," she said. "I'm not—" He started again. "I'm not looking for absolution. I'm correcting the record, because the record should be correct." He looked at the bay window, at the patient visible through the glass. "You knew things last night that I didn't know you knew. That's not an excuse. I should have listened to your clinical assessment on its own merits rather than filtering it through assumptions about your role." "Yes," she said, "you should have." The directness of it landed, and she watched him receive it without deflection, which was the most she could ask of anyone, that they sit with accurate feedback, without immediately managing it into something more comfortable. "Is there anything I can do?" he said. "Go home," she said. "The panel has what it needs." He left. She delivered the medication. The preliminary session with Holloway began at 6:02 p.m. With a 2-minute delay caused by a scheduling conflict in Recovery Room B, the other patient needed an unplanned procedure that moved him briefly back to post-op, which created a logistical gap that the panel liaison filled by rearranging the seating configuration. Mara was not in the room. She was outside it, in the hallway, on her feet, with the particular stillness of someone waiting for an outcome they have done everything possible to influence and must now allow to proceed without them, which was its own of discipline, different from action, but not easier. Vickers was beside her. He didn't say anything for a while, which she was glad of. "Then, you went to see her, Dravet's?" "Yes." Callahan said the documentation was complete. It was. He was quiet again. Down the hallway, through the closed door, the panel session was happening. Holloway's voice, which she could not hear through the door, explaining to 5 people the 8 months of work that had led to a device on an aircraft and a fragment in his chest, and a nurse doing a bedside pericardiocentesis at 1 in the morning in Spokane, Washington. "You know what they're going to find when they run the routing trace? All the way back," Vickers said. It wasn't a question. "I have an idea," she said. The board member. "His name is Roland Pace. He's been on the Shell Company board for 4 years. He's also been a credentialing consultant for regional hospital systems for 11 years. Vickers paused, including Harwell. She had not known that last part. She had suspected a connection between the credentialing system and the Shell Company, because the mechanism of how her intake information had been accessed suggested someone with institutional knowledge of hospital administrative structures. But she hadn't known the name. "He's on the panel," she said. "Third seat from the left," Vickers said. Inside that room, Holloway was laying out the evidence. The flight plan modification, the device, the routing trace, Danielle's statement, the documentation from Sona Dravet's. the chain that connected a supply operations protective infrastructure to a hospital credentialing consultant who had known from the moment Mara's intake paperwork crossed his network exactly who she was of it and why her presence at Harwell was a problem for people with reasons to make it one. Pace had not put the device on the aircraft himself, but the information flow that had allowed the people who did to know where Holloway would be and when the flight plan access, the timing. The specific knowledge of Holloway's asset operation ran through a network that Pace had participated in building. Mara thought about signing her first disciplinary form 6 weeks ago. The pen in her hand, the form on the desk, Danielle standing there with the managed authority of someone delivering a consequence she had decided was warranted. She thought about what she had felt, not injustice, not exactly, but the particular exhaustion of being assessed by people who were reading a single visible surface and deciding that was the whole picture. She had signed it. She had gone back to work. She had kept the dog tags under her scrub top and the application on her phone and the operational habits in her hands, because those things had not required her to perform them, and they did not disappear when she chose not to display them. The door to Recovery Room B opened. A woman, one of the panel members, whom Mara recognized as the liaison who had arranged the seating, stepped into the hallway and looked at Vickers. "Sergeant Major, Commander Holloway is asking for Nurse Ellison." Vickers looked at Mara. She went in. The room had been rearranged. Holloway's bed raised slightly, a table positioned to the right, with 5 people seated behind it, 4 of them with the contained professional attention of people in the middle of something significant, and one of them third from the left, as Vickers had said, with a different quality of attention, a particular tightness that was not the tightness of someone engaged with the material, but of someone monitoring how the material was landing. Pace was 57, gray-haired, with the surface effect of an institutional man in full measured voice, conservative jacket, the kind of practiced approachability that worked well in credentialing meetings and administrative reviews. He looked at Mara when she entered the room, and it was not the look of a stranger. She knew that in the second it lasted, because it was the look of a person confirming something they had already been tracking. She filed it and looked at Holloway. Holloway looked better than he had at noon, not well, not close to well, but present in a way that the earlier conversation hadn't quite had, as though the session had given him something that the recovery room had been unable to provide. He met her eyes and nodded once. "This is Nurse Mara Ellison," he said to the panel. "She's the reason I'm in this room, rather than in the ground. I've asked her here because the panel needs to hear directly from the clinical provider who was present for the overnight interventions, and because her presence in this hospital on this night is relevant to the investigation in ways I've already outlined and will not repeat." The panel chair, a woman in her 60s named Dr. Harriet Voss, whose reputation in Federal Medical Review Mara knew only by reference, thus looked at, sought Mara with the comprehensive assessment of someone who processed a significant volume of information quickly. "Ms. Ellison," Voss said, "thank you for agreeing to speak with us. I want to clarify that this session is preliminary and informal. Nothing said here constitutes formal testimony, and you are under no obligation to—" "I understand," Mara said. "I'll answer what I can." Voss nodded. What followed was 40 minutes of questions, careful, systematic, professionally framed questions from 4 members of the panel, interspersed with Mara's answers, which she gave with the same flat sequential precision she'd used for every clinical handoff she'd ever delivered in every setting she'd ever worked in. The pericardiocentesis, the fragment trajectory inference, the tamponade diagnosis, the Gerald Peck documentation, her training background, which she described in terms that were accurate and complete, and which she had previously been selective about sharing. Pace asked 2 questions. Both of them were framed as clarifications, but both were structured to direct the panel's attention toward the scope of practice question. toward whether a civilian nurse performing a bedside pericardiocentesis constituted an unauthorized clinical intervention, and away from the question of why she had the training to perform it and what the outcome had been without it. The third time he began a question, Voss interrupted him. "Mr. Pace," she said, "I think we've established the scope of practice framing sufficiently. Let's move to the training background documentation." Something moved across Pace's face. It was brief, very brief, but Mara was watching for it, because she had known from the moment she walked into the room that this was the inflection point. The moment when the investigation's formal record and the panel's visible dynamics either aligned or diverged, and the divergence or alignment would be visible in the face of the man who had a reason to want them to diverge. What she saw in his face was the look of someone who has realized that the room is not arranged the way they expected it to be. Voss was already moving. The panel has received Commander Holloway's evidence package, including routing documentation submitted to this session by an external investigation team. We've also received a statement from a hospital employee regarding 2 calls made to this facility from a number traced to a corporate structure with documented connections to. Voss paused. She looked at Pace. Documented directionally, with documented connections to entities under investigation for obstruction of a federal asset protection operation. The room was very quiet, Mr. Pace, Voss said. The panel is going to take a brief recess. During that recess, you will be asked to step outside with the liaison. I want to be very clear about what that means. Pace looked at her. The managed composure was still there. It was the composure of a man who had practiced it for decades and could sustain it through significant pressure. But beneath it, in the angle of his shoulders and the position of his hands on the table, something was resolving into a different shape, the shape of a structure that has had its load-bearing element removed and is in the process of redistributing the weight before it decides whether to hold or collapse. I understand, Pace said. He stood. The liaison was already at the door. Mara watched him walk across the room, the measured pace, the maintained posture, the performance of a man exiting under control, and she thought about the intake desk 6 weeks ago, the forms she'd signed, the credentialing documents she'd handed over, and the person on the other side of that desk who had looked at her name and recognized it and made a phone call that night to people who needed to know she was in Spokane. She had signed those forms with the same pen she'd signed Hext's disciplinary notice with. Neither signature had been defeat, but she hadn't known at the time what they were instead. The door closed behind Pace. Voss looked at Mara. "Miss Ellison, the panel is going to need your complete operational record, not your nursing file. The full record." She held her gaze. "Are you prepared to provide that?" Mara thought about the worn cord against her sternum, the weight of the metal, the 14 months that the record described, and that she had spent 3 years keeping at the periphery of her daily life, visible only to herself, pressed against her skin like a reminder that the past didn't stop being true, because you stopped looking at it directly. "Yes," she said. Voss nodded, looked at her papers, looked up again. "One more thing. The panel is going to recommend an immediate administrative hold on all personnel actions against you, pending the completion of this review." She paused. "The incident reports filed this evening have already been flagged for evaluation as potentially retaliatory. Dr. Hecht's withdrawal request is on record and will be incorporated." Mara said nothing. "Is there anything you want to say for the preliminary record?" Voss asked. She thought about Gerald Peck, whose spleen had been saved, because she had documented a clinical concern at 8:33 p.m., and someone had eventually looked at the timestamp. She thought about Commander Holloway's heart beating beneath her hand in the trauma bay, the specific sensation of cardiac muscle finding its rhythm against her palm, the way that sensation did not diminish in memory the way other things did. She thought about Danielle's handwriting across 4 pages of spiral-bound notepad paper, the handwriting of someone who had been carrying something alone and had set it down. "No," she said. The record says what it needs to say. Voss made a note. The preliminary session concluded at 6:48 p. Mara walked out of Recovery Room B into the hallway where Vickers was still standing, and the hospital was still moving in its rhythms around them, and the ordinary work of a place that processed crisis was continuing unchanged. Because hospitals did not pause for the resolution of things happening inside them, they simply absorbed those resolutions into the ongoing flow and kept moving. Her phone buzzed. Callahan. She answered it. Pace is being escorted off the premises, he said. Federal agents arrived 12 minutes ago. The routing trace completed. It goes through 3 shells and lands on 2 individuals who are already in the investigation file. A pause. It's done, Mara. She stood in the hallway and felt the specific quality of a weight that had been present so long. Last night, she'd stopped registering it as separate from herself until the moment it was gone, which was the only moment she could actually measure it accurately. The asset? She said. Dravets is being moved. She's already in transit. Another pause shorter. She asked me to tell you the documentation was thorough. Good. The panel is going to want formal testimony next week. Holloway will be at the Tacoma facility. By then they'll route through there. He paused. And they're going to want to talk about your operational file. The full version. She had said yes to that already, in front of Voss, and she meant it the way she'd meant it, not with enthusiasm, but with the particular acceptance of a person who had understood for some time that the drawer she'd put the past in had never been entirely closed, and that reopening it properly, in the right context, was different from pretending it didn't exist. I know, she said. One more thing. His voice had changed, not professional anymore, or not only professional. Something underneath it. The 23-year-old in Minnesota. His name is Dario Fells. He found out you were at Harwell. He sent a message through the system. A pause. He said to tell you his team won their last 3 games. She pressed her back against the wall. Her eyes closed once. Then she opened them because the floor was still there, and the patients were still there, and Tommy Riddell was visible through the nursing station window, pulling a chart with the focus of someone who had not yet heard anything that had happened in the last 24 hours and was doing his job with the simple attention that the job required. Tell him congratulations, she said. She hung up. She stood in the hallway for a moment, longer than was strictly necessary. Then she heard it from somewhere behind the closed door of Recovery Room B, from the room where Holloway was still present, still in the bed where she had left him a single sharp sound. Not a monitor, not a mechanical alarm, a voice, urgent. She was already moving when Tommy came out of the nursing station at a run. Bay B, Tommy said. Holloway she pushed through the door. The drainage tube from Holloway's chest had disconnected from the collection chamber, not cleanly, not by design. The connector housing cracked through in a way that looked like stress failure, but was located at a junction point that should not have experienced that kind of stress without external force. And the drainage was now tracking backward. And Holloway's oxygen saturation was dropping from 94 to 89 and falling. And his face had gone the color of something that needed to be fixed in the next 90 seconds. Mara looked at the cracked connector. She looked at the position of the brake. She looked at the door, which had a small window, and through the window she could see the hallway. And in the hallway she could see a figure moving away from the door with the particular pace of someone who had just been somewhere they shouldn't have been, and was now leaving at the specific speed that was fast enough to create distance, but not fast enough to look like running. She had 1 second to make a decision between 2 things she needed to do simultaneously. She grabbed the drainage tube with one hand and looked at Tommy. Fix the connector. There's an emergency chest drain kit in the top left cabinet. Move. She kept her hand on the tube, maintaining manual seal. And call security. Tell them someone just accessed this room who wasn't on the access list. The hallway camera now. Tommy was already at the cabinet. I don't know who yet, she said. That's why we need the camera. Her hand held the seal. Holloway's saturation steadied at 87 and stopped falling. Tommy got the kit open, and in the hallway outside recovery room B, the figure reached the stairwell door, the same stairwell where Mara had taken 2 phone calls today, where she had pressed her back against the cold concrete and listened to things that changed the shape of what was happening around her and pushed through it. The doors swung closed. The camera above it had a clear angle on the face. The connector seated on the second attempt. Tommy's hands were shaking slightly, not badly, not enough to impair function, but enough that Mara could see it and register it as the appropriate physiological response of a 26-year-old who had just been told to fix emergency chest drain equipment while his colleague held a manual seal with one hand and called for a security response with the other. She didn't comment on the shaking. She watched the seal establish, watched the drainage resume its proper direction, and watched Holloway's saturation begin its slow climb back toward viable 88, 90, 92. Good, she said. Check the housing on that connector. Tell me if there's anything else compromised along the line. Tommy ran his hands along the tubing. Looks intact from here to the insertion point. Pressure? He checked. 84/51. Low, but not falling. She could work with not falling. Holloway was looking at her. His face had the particular tight focus of a man managing significant pain while simultaneously trying to track what was happening around him, a practiced compartmentalization, she recognized, from people who had spent years in environments where the luxury of attending to only one thing at a time didn't exist. Someone came in here, he said. Not a question. Yes. Pace was already being walked out. Pace wasn't working alone, she said. She was still watching the monitor, still keeping one hand near the drainage housing. He was the information end. There's an operational end. Someone decided that if the session was already compromised, the cleanest remaining option was to ensure you didn't make it to Tacoma. A beat. They disconnected my drain, he said. Stress fracture in the connector housing at a junction point that doesn't experience that kind of force naturally. She met his eyes. Someone applied external pressure to the connector before they left the room. Holloway's jaw tightened. The door opened and Vickers came in at speed, one hand already on his radio, with the particular forward momentum of a man who had been in the hallway when the alarm registered and had covered the distance between there and here in about 4 seconds. Report, he said. He's stable, Mara said. Drainage restored. Camera footage on the stairwell exit I need. That pulled now. Already called. Vickers looked at Holloway, made his own rapid assessment, and shifted back to Mara. Security has the stairwell. The door at the ground level exit didn't open. Whoever it was is still in the building. Mara looked at the window in the door. The hallway beyond it was visible, and in the hallway the ordinary traffic of the 3rd floor was continuing a dietary cart, a physical therapist, a man in a visitor badge who was walking toward the elevator with a phone in his hand and his face angled slightly away from the nursing station camera. She pointed. Vickers turned. The man reached the elevator and pressed the button. That's not a visitor, Mara said. He's been on this floor for at least 40 minutes. I saw him when I came back from Pole's office. Vickers was already on his radio. The elevator doors opened. Security met the man before he stepped inside. His name was Curtis Devane. He was 44, employed as a private security contractor through a firm whose client list, when the investigation eventually ran it fully, would prove to include 3 of the corporate entities connected to the supply titration operation. Holloway had been building a case against for 8 months. He had a visitor badge registered to a name that matched a legitimate Harwell visitor who had signed in at 2 p. For a patient on the 2nd floor, a patient Devane had no connection to and had never approached. He had obtained the badge by representing himself at the front desk as the registered visitor's colleague, arriving 30 minutes after the legitimate visitor had signed in, and while the desk was managing a simultaneous insurance verification call that had The coordinator's attention divided. The badge system at Harwell relied on self-attestation for visitor companions. It was a gap that had been noted in an administrative review 2 years prior and not yet corrected. Devane said nothing when security stopped him. He didn't need to. The camera footage from the stairwell exit showed his face clearly. It faced the moment he had pushed the door entering from the hallway, timing consistent with the window between the preliminary session's conclusion and Holloway's drainage alarm. His right hand, visible in the footage, was carrying nothing. His left hand, visible for approximately 1 frame as the door swung open, showed the particular angle of fingers that had just released something. The connector housing fragment, recovered from Recovery Room B, matched the stress fracture pattern to a deliberate lateral compression, the kind applied by someone who knew exactly how much force was required to crack the housing, without making a sound that would register in the room. Devane had known what he was doing. Mara had stopped what he'd done in time, because she'd looked at the break pattern and understood what it meant, not because everything had gone according to any plan she'd had, but because the particular kind of attention she'd spent years building didn't turn off when she decided it was inconvenient. Federal agents arrived at Harwell at 7:34 p.m. Devane was taken from the building in handcuffs, through the lobby, past the desk where the visitor badge gap had been exploited, past the framed photographs of smiling patients in rooms that looked cleaner than any real room, and out through the automatic doors into the cold Spokane evening. Mara watched it from the 3rd-floor window. She was not triumphant. Triumph was the wrong word for the feeling triumph implied: a clean win, a clear score, a satisfying conclusion that resolved everything with appropriate emotional punctuation. What she felt was more complicated and less aesthetically satisfying than that. She felt the particular exhaustion of having held a great deal together under pressure for a long time, and watching the pressure finally release, which was less like victory and more like the moment after you've held a difficult position for so long, that when you're finally relieved, your muscles don't know what to do with the absence of strain. She felt that. She felt it and acknowledged it, and then she went back to check on Holloway's drainage because he was still her patient, and his drain had been compromised, and satisfied feelings did not constitute a medical assessment. The full panel convened at 7:52 p. in the hospital's 3rd-floor conference room without Roland Pace, who was at that moment being interviewed by federal agents in the hospital director's office, an irony that Mara registered without dwelling on. The session lasted 2 hours and 11 minutes. Mara was present for the first 40, then excused while the panel deliberated, and she spent those hours on the floor because the floor still needed her, and because sitting in a waiting room for an outcome she couldn't influence was not something her body knew how to do without the structure of work to hold it still. Tommy was at the nursing station when she sat down. He looked at her with the open record face she'd come to recognize as his default register: no performance, no managed affect, just a 26-year-old processing the events the last several hours with the sincere bewilderment of someone who had come to work expecting a standard overnight rotation. "Are you okay?" he asked. "I'm functional," she said. "That's not what I asked." She looked at him. "I know." She picked up a chart. "Ask me again next week." He nodded, accepting it, and went back to his documentation. At 10:06 p.m., Dr. Voss appeared at the nursing station. She was a single sheet of paper, which she placed on the counter in front of Mara without preamble, because Voss was not a woman who used preamble when the document said what needed to be said. Mara read it. It was a preliminary finding, not the full report, which would take days to finalize, but a summary of the panel's immediate determinations. The clinical interventions, performed by Nurse Mara Ellison on the night of Commander Brant Holloway's admission, were determined to be appropriate, necessary, and consistent with her documented training and demonstrated competency. The pericardiocensus, performed under time-critical conditions, with physician awareness and without objection, was classified as an emergent intervention within the reasonable scope of a provider with her specific background. The two formal incident reports filed by Dr. Callum Hext were determined to reflect a pattern of response to legitimate clinical input that the panel characterized as inconsistent with the hospital's stated standards for interprofessional collaboration. Both reports were to be expunged from her personnel file. The panel further recommended that Harwell Memorial's administration conduct a comprehensive review of the conditions that had allowed the incident reports to be filed without independent clinical review, a process that the finding framed, carefully and with institutional precision, as a systemic gap rather than an individual failure, while noting that systemic gaps were sustained by individual choices. Danielle's name appeared in a footnote not as a primary subject, but as a cooperating source whose statement had been material to the panel's understanding of the information flow that had enabled an unauthorized party to access clinical data. The footnote noted that her cooperation had been voluntary and that the panel recommended a separate administrative review of the hospital's information sharing protocols. Mara set the paper down. Voss was still standing there. "The full report will incorporate your operational record," Voss said. "The federal investigation will proceed through appropriate channels." Holloway's transport is being rescheduled for tomorrow morning. His medical team cleared the delay given tonight's events. "Is he stable?" Mara said. "More stable than his drain was an hour ago, from what I understand." Voss's expression shifted not warmth exactly, but the particular quality of professional respect that had its own specific character, different from warmth but not lesser. The panel is formally recommending that Harwell's administration engage with you regarding a potential role expansion. The specific shape of that is between you and the hospital. "I'm a trauma rotation nurse," Mara said. "You are," Voss said, among other things. She picked up the finding. "Thank you, Miss Ellison." She left. Mara sat at the nursing station for a moment with her hands in her lap. Among other things, she thought about the phrase, about the specific weight of a life that contained more than its visible surface, but because she had been deceptive, but because about what she carried openly and what she carried close, and those choices had been hers to make, and she did not apologize for them. What she had kept private had not been cowardice. It had been the reasonable decision of a person who had spent years giving everything to a structure that consumed everything given to it, and who had needed, finally, to find out what remained when the structure was removed. What remained had been this: a woman who showed up, who noticed things, who did not stop noticing things when instructed to, who held manual seals with steady hands and documented clinical concerns at 8:33 p.m. and read the trajectory of wounds from their entry points, and drove her 9-year-old Subaru to a residential address in Spokane to examine a woman who needed to be seen. That was what remained. It was, she thought, enough to build something from. 3 weeks later, Pohl called her into his office. He stood when she came in, which she had decided was simply his habit rather than a particular signal, though it was a habit she found she didn't mind. "I'll be direct," he said, which she also appreciated. He was offering her a position, not the trauma rotation, which had always been temporary, but something that had been assembled in the weeks following the panel's recommendations, with input from Voss's formal recommendation, and from a conversation Pohl had with the hospital's medical education board about a gap that had existed at Harwell for several years. The gap was this: Harwell trained residents, it ran nursing rotations, it had a robust simulation program for standard clinical scenarios, but it had no formal program for critical response in austere conditions. No training for the situations that didn't look like the simulations. No curriculum for reading what you couldn't measure. What Pohl was offering her was the position of clinical lead for a new critical response training program, which would operate in parallel with her patient care role and which would have the authority to design its own curriculum. You'd report to Marsh on the clinical side and to me on the administrative side, he said. The position is new enough that you'd be defining its shape. I've never designed a training program, she said. I know. Marsh says that's probably an advantage. He paused. She also said you have a way of teaching, without calling it teaching, that she noticed during the Holloway response. The way you directed Hext. Mara thought about that. About the specific moment when she had said, "Follow my instructions," and he had, because the situation had stripped away everything except the clinical reality. And in that stripped-down space, the hierarchy that had been organized around credential and title and tenure had reorganized itself around something more primary, around who in the room knew what to do next. I'll think about it, she said. Take the week, Pohl said. I don't want an answer under pressure. She nodded. She left his office and walked the carpeted corridor, the sans serif quotes, the clean photographs, and pushed through the doors to the clinical floor, where the smell changed back to antiseptic, and the day was already generating its particular pattern of needs, and she had patients and documentation and a shift that wouldn't care about her week to decide. She went to work. Holloway called from the Tacoma facility 10 days after his transfer. She was in the break room, eating a sandwich she'd had since noon without managing to finish, and she answered on the second ring. How's the drain site, she said. Marsh's resident said it's healing normally. His voice was better than it had been. The roughness from the tube was gone, and underneath it was the voice of a man who was accustomed to bouncing back from things and had some evidence now that this would be another instance of that pattern. I wanted to call before the formal testimonies session next week. All right, I wanted to say. He paused, not searching for words, she thought, choosing between several. What you did at Harwell. The documentation on Dravet's, the Crow statement, staying on Holloway's clinical care through the panel session, and the drain incident. That's not what anyone brought you there to do. Nobody brought me there to do anything, she said. I got a job posting, I know. That's my point. Another pause. Devane's legal team is arguing the drain incident was coincidental equipment failure. They'll lose the forensic analysis is conclusive, but they'll argue it. I wanted you to know that before the testimony. I know how to testify, she said. I know you do. Something in his voice, not amusement exactly, but the quality adjacent to it, the quality of a person who finds something true and recognizable rather than funny. Dravet's is in a secure location. The supply chain investigation added 3 new subjects based on the documentation you provided. The case goes federal in 6 weeks. Good, she said. Ellison. He said her name with a particular weight, the weight of someone who had something to say and was deciding whether the context warranted saying it. I've read your full operational record. The panel reviewed it. What you did in those 14 months, the people you kept alive in conditions that most surgeons would have found unworkable, that record is going to follow you now. It's not sealed anymore. She set down the sandwich. Outside the break room window, the hospital parking lot was gray under February light, the kind of light that made everything look like it was waiting for something to change. I know, she said. Does that bother you? She thought about it honestly. About the drawer she'd kept closed for 3 years, the worn cord, the weight against her sternum, the dog tags that had been her private accounting of a part of herself she'd continued to carry without displaying. She thought about whether the exposure of that record felt like a loss of something or a release of something, and she found that the answer was more complicated than either of those words. It changes things, she said. It doesn't bother me. What will you do with it? She looked at the parking lot, at the gray light, at a man in a visitor badge walking toward the entrance with his hands in his pockets and his breath fogging in the cold. Pohl offered me a training position, she said. Critical response curriculum. I'd design it from scratch. A beat. Are you going to take it? I think so, she said. I haven't told him yet. Why not? Because I wanted to sit with it for a while before it became a decision. She paused. I've made fast decisions in conditions that required fast decisions. This one doesn't, so I'm letting it be slow." Holloway was quiet for a moment. When he spoke again, his voice had lost the professional layer entirely. It was just a man recovering in a facility in Tacoma, talking to someone he owed something to. "The 23-year-old in Minnesota," he said. "Dario Fells. He played for my unit for one deployment. I was his commanding officer when his aircraft went down. I wrote the casualty projection myself before the evacuation reached him." He paused. "His team's record this season is 8-2. He sent me the stats last week." She closed her eyes once. "He's good at coaching," she said. "Yeah, a breath. He is." She finished the call. She sat psychotically, professionally. She sat in the break room for another 4 minutes, which she had not planned but which her body apparently required, and then she stood up, wrapped the unfinished sandwich, and went back to the floor. She told Paul yes on a Thursday. She told him in the carpeted corridor, not in his office, because she'd run into him near the clinical floor entrance, and he'd looked at her with the expression of someone who had been patient about waiting, and was approximately at the limit of it, and she decided there was no reason to make him wait through the additional 2 minutes it would take to walk to his office. "Yes," she said. "I'll take the position." He looked genuinely relieved, which she found humanizing. "When can you start the curriculum work?" he said. "I'm already started," she said. "I've been thinking about it for 2 weeks." He nodded. He did not ask what she'd been thinking. He had the administrative intelligence to understand that some processes required their own time, and that interrupting them to ask for a status update was not useful. He simply nodded and said he'd have the formal offer letter in her hands by Monday. She went back to the floor. Tommy was at the nursing station. He had, in the weeks since the night of Holloway's admission, developed the particular quality of someone who had watched something happen that reorganized his understanding of what was possible, and who was still integrating that reorganization into how he moved through his days. He was a better nurse for it, not because the event itself had taught him clinical skills, but because it had expanded his idea of what a clinical provider could hold. She had watched that expansion happen without calling attention to it, because the most useful teaching was often the kind that didn't announce itself. "Dr. Hext asked about you," Tommy said, not looking up from his documentation. "What did he ask?" "Whether you were staying." Tommy did look up now. I told him I thought so. "Was that right?" "Yes," she said. That was right. He went back to his documentation. She sat down and pulled up the curriculum document she'd been building in her personal files, not on the hospital system. Not yet, because it wasn't the hospital's until she'd decided it was good enough to be, and she was not in the habit of turning over incomplete work. She read what she had so far, 14 pages of framework, organized almost around the principle that clinical competence in real conditions required the ability to read what the instruments didn't measure, to see trajectory from an entry wound, to hear what a patient wasn't saying, to hold a manual seal while simultaneously making decisions that weren't in any simulation protocol, because the simulation had never accounted for the connector being cracked by someone who wanted the patient dead. She had called the framework Austere Conditions, Assessment and Response. The title was functional and not poetic, which was appropriate, because what she was building was not a monument. It was a tool. Tools were useful in proportion to their precision and their durability, and she intended it to be both. She would teach residents to think about what they couldn't see by looking at what they could. Teach nurses that the observation documented at 8:33 p.m. was not a subordinate act, but a clinical one, and that the record was not a bureaucratic performance, but the thing that remained when everything else had been argued away. She would teach people to hold the seal with steady hands and call for what they needed and not stop until the rhythm returned. She would do this because she knew how, and because knowing how and not teaching it was its own kind of waste, and because the 23-year-old in Minnesota and the people who came after him deserved to have came after him, to have someone in the room who had learned to look at what the room didn't show. In the second week of March, Mara was running a small group simulation with 3 residents and a nursing student named Petra Vall, who was 22 years old and had the particular quality of someone who noticed things and hadn't yet been taught to discount her own noticing. The simulation was a chest trauma scenario. Standard presentation, non-standard complication, built into the scenario design, a fragment trajectory that didn't match the entry wound angle, which the simulation was designed to surface as a clinical decision point. Petra caught it, not the residents. Petra. She raised her hand, an unnecessary gesture in a simulation room, but an instinctive one, and said, "The entry wound doesn't match the mechanism they described. The fragment should have traveled laterally, but the bruising pattern suggests it went medial. That changes where we should be looking." The 3 residents looked at her. Mara looked at her. "What made you notice that?" Mara said. Petra blinked. The angle seemed wrong. I might be incorrect." "You might be," Mara said. "Run me through the reasoning." Petra ran her through it, careful, slightly uncertain. The reasoning of someone who trusted her observation, but not yet her own right to act on it, which was a gap that existed in a lot of people. And that training either widened or closed, depending on whether the training observation as the beginning of clinical thought or as a subordinate input to physician direction. "You're not incorrect," Mara said. "Keep going." Petra kept going. The residents watched. After the simulation, one of them, a second year named Marcus Fell, stayed behind to ask Mara a question. He was earnest in the way of young physicians who had not yet been in enough situations to know which things they hadn't been taught to think about. "Where does that kind of observation come from?" he said. The trajectory reading. "Is that something you learn from a textbook?" "No," she said. "Then how do you learn it?" She thought about that answer, the real answer, not the professional shorthand. She thought about the 14 months and the aircraft and the cargo strap and the flashlights. She thought about a woman with carefully held hands who had needed to be seen. She thought about a cracked connector housing and the camera angle that had caught a face and the specific texture of holding something together under pressure until the relief arrived. She thought about what she would have said 6 weeks into her Harwell rotation, before the night that opened everything up. She would have given a shorter answer: flight, medic training, the clinical language, the deflection she'd become practiced at delivering. She didn't give that answer now. You learn it by taking seriously what you observe before anyone else confirms. It's worth taking seriously, she said. You learn it by not waiting for permission to trust your own clinical read. And you learn it by understanding that the thing you notice in the first 30 seconds of looking at a patient before the chart, before the physician assessment, before the hierarchy of the room tells you where your attention should be, is often the most accurate thing you're going to see all shift. Marcus looked at her. And if the physician tells you you're wrong, then you document what you observed with a timestamp, and you make sure the record is accurate. She held his gaze. The record doesn't argue. It doesn't defer. It just says what happened and when. And if you were right, the record shows it. That's all the vindication that matters, not being believed in the moment, but being accurate in the record. Everything else follows from that. He nodded slowly. She collected the simulation materials. At the door, she paused. Behind her, the simulation room had the specific silence of a space in the interval between uses the equipment reset, the scenario markers cleared, the room ready for the next group of people who would stand in it and be asked to see things they hadn't been trained to see yet. She thought about Petra Vall raising her hand, saying the angle seems wrong with the uncertain precision of someone whose observation was correct and whose confidence in the right to act on that observation was still being built. That was the work, not the tamponade, not the pericardiocentesis, not the documentation that had cracked a case 8 months in the building and put a contractor in handcuffs in a hospital elevator. Those things had been necessary, and she had done them, and she did not minimize their weight. But the ongoing, daily, unglamorous, essential work was this: teaching people to raise their hand, to say the angle seems wrong, to document the observation at 8:33, and to trust that the timestamp meant something, to hold the seal and call for what they needed and not release it until the rhythm returned. The drain, the documentation, the steady hands, the quiet nurse who stayed. She turned off the simulation room light and walked back to the floor, where Tommy was at the nursing station, and the patient board was full, and the day had 3 hours left, and none of it would wait for her to feel ready. She sat down. She pulled up the first chart. She began.